If you have a vacuum erection device or you're considering getting a vacuum erection device, you're going to have questions. And we have made over 100 videos on this channel to help answer some of those questions. But sometimes questions come in and somebody hasn't had a chance to watch a lot of the videos. So I want to respond to some of those questions in this video. I've got 5 questions that are, I think, important. And these have come to us through the email address, education@timmedical.com. So let me answer the questions the best I can. 5 questions, try to keep this short and respect your time. All right, the first question one of our users asked was, if I have a good contact here between the pump and the cylinder, and it's secure and it's tight, do I need to add lubricant in this space to just make sure I've got an even better vacuum seal? And the answer to that question is you do not need extra lubricant, and whether that's with an Erection, Postivac, either one of these systems that we manufacture and sell here at Tim Medical, you do not need extra lubricant to create the vacuum seal, but make sure everything's working when you first get the device. So without a cylinder attached, take your pump, apply it to the palm of your hand, 3 or 4 squeezes. You can see there that I'm not holding this. This is holding on to me with that vacuum draw. And then I want to test it with the pump and the cylinder. So I insert the pump into the cylinder, just like that. I've got a good seal, nice and snug and tight here. And then I'm going to do the same thing, about 3 or 4 squeezes here, aggressive. And then I've got a good seal. I am not holding on to the cylinder. The cylinder is holding on to me here. So you can see I've got a good seal, no lubricant. If you like that extra level of assurance that you've got a good vacuum seal, you've done all of those steps and you feel good about it, but if you want to apply lubricant, you certainly can to this space right here, but you don't need to. But if you do that, make sure you pull these apart, clean up with a washcloth, wet washcloth here, wipe this down here. Do not submerge these pumps in water. You can see that there's a hole in here. That's the vacuum hole. If you get water into that, you can damage the system. So don't apply and dip this in water or the dishwasher. Just nice wet cloth and you're good to go. So that's the first question. All right, the second question is, when I'm starting with my system, what's the best position for me to be in when I begin the process of building the erection? This is a personal choice. Some men like to lie down on their back. Some men like to stand up. Some people like to sit in a chair, but it's entirely up to you. But I want you to think about what you're trying to avoid when you first begin with the vacuum erection device. One of the first challenges I think men face when they begin building their erection is the penis gets caught somewhere on the cylinder where there's not enough lubrication. So if I'm lying down on my back and my penile tissue's sort of aiming upright, there's a lot of opportunity for it to go any direction that it wants to go as I'm beginning the process. So let's say that I'm here and it curves up and it catches the side where I haven't lubricated the inside of the cylinder. There's going to be friction. There's going to be moisture in there and it may curl and slow down your process. If you're standing or sitting upright, then really you've got to focus on the bottom of the cylinder with the lubrication. So I'm going to use this water-based lubrication that comes with your system. I'm going to apply this on the inside of the cylinder, mostly on the bottom, because that's where my penis is going to track as I'm building the erection. So I want to make sure if I'm well lubricated, less friction, more likely that it's going to keep going right along that same track. If you choose to lie on your back, entirely up to you, I would encourage you to not only lubricate the entire perimeter on the inside here on the cylinder, but lubricate your penis as well, so that if you're in this position and it wants to go to the side, it's not meeting that same resistance, that same friction level. So it's the position that you prefer, what gives you the best shot at success. I encourage upright, whether seated or standing, but again, that's entirely up to you. All right, the third question is, we coach here at Tim Medical, when you're using a tension ring and you've built the erection, you've applied this to the base of the penis, and we got a lot of videos on our channel here that teach you how to do that. But the question is, we're always coaching no longer than 30 minutes should this tension ring be on the base of your penis. We want to get oxygen-rich blood back into the penis, and the only way to do that, if you have this applied to the base of the penis, is to remove it. We've got another video that teaches you how to do that safely, but make sure that when you go to remove the tension ring from the penis, you re-lubricate the entire penis, try to get it inside here, open it up as much as you can, and then slide it off safely. Always want to be safe. You don't want to rake this across the tissue of the penis. You may end up with some bruising, and nobody wants that. But the question is, in the time period that I'm wearing the tension ring, that 30-minute window of opportunity, even if I have one orgasm, two orgasms, am I allowed to keep this on the base of the penis even after those occur? Now, the first thing I'll tell you is that a lot of the men who use the tension rings or the vacuum erection devices are no longer able to ejaculate. So you may have an orgasm, but you're not ejaculating any semen. If you're having an orgasm while you're wearing this and you are able to ejaculate, you want to make sure that whether it's this particular tension ring, which is the Erection tension rings, you see the urethral notch always has to be at the bottom of the penis. And that allows, if you are able to ejaculate, and even if you're not, it's safe to keep the tension ring on the penis for 30 minutes or less. Whatever you do within that time frame is up to user discretion. The fourth question we received from one of our users of the system is the device meant to be used for ED alone? Or if necessary, can it be used in conjunction with small doses of a PDE5 inhibitor medication? Some of the brands that come to mind are Viagra, Cialis, the generic versions, sildenafil, tadalafil, avanafil. Can you use a vacuum erection device while also in conjunction with one of those oral medications? Now, this is one where I want to point you in the direction of the American Urologic Association and their coaching. And even more importantly, this is something that you work with your doctor on. If your doctor's already prescribing Cialis in a low dose post-radical prostatectomy surgery, or you were already taking sildenafil and you want to incorporate the vacuum erection device, the American Urologic Association coaches that you talk to your doctor, make sure everything's safe to use both in conjunction with one another, but it's not unheard of and probably more common than you realize. But that's not us speaking as medical professionals. If that's something you want to do, that's a question you bring up to your doctor. All right, number 5, we received a question this week where the user of a vacuum erection device has been successfully building erections, able to transfer the tension ring from the cylinder onto the base of the penis. But the user said that my wife feels the tension ring during intercourse. Now, imagine that you've got the tension ring onto the erect penis as close to the body as you can possibly get it. And by that, I mean as close to the pelvis as you can. So you have ample erection to work with. You don't want this thing landing about right here. Then you've shortened the length of the erection. So I'm here, I've got the tension ring onto the base of the penis. 2 adjustments you might need to make. First of all, make sure that you've got the tension ring well lubricated even while you get it on there so it doesn't create friction for your partner. But also, it just may mean your penetration is less deep. But the tension ring may be felt by your partner. It just might mean some adjustments on your part, whether it's depth of penetration, lubrication here. We've got the positive rings, which may provide an alternative to this ring, and just in terms of being rounder and softer for the user and the partner of the user. All right, those are the 5 questions for this week. If you have other questions that you want to ask us, you can always write to us at education@timmedical.com. We always do the best we can to not only answer the question directly, but usually it's going to end up in a video down the line. If you have comments, just leave a comment for this video and we'll do the best we can to respond. And you'll notice I didn't draw attention to anybody who asked the question. I'm just going to generally do the best I can to answer them and help you be successful with your system. And one final note, always use the code YouTube15. That's YouTube number 15 if you want to save 15% off of any purchase at timmedical.com.